The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. Welcome back. If you are thinking about cosmetic surgery, you probably have a lot of questions, and that's a very good thing. Here to talk about whether or not a facelift is the best way to combat wrinkles is the face doctor, Michael Jasin, from the Jasin Facial Rejuvenation Institute, and he has brought along a patient, Sharon Martin. Good to have you both here.
Thank you.
Doctor, we have a question from a viewer, and she says, I have a lot of wrinkles on my face. I think I need a facelift. Is that necessarily the best thing for her?
It could be the best thing, but it might not be the best thing. I think a lot of people have a misconception about facelifts, thinking that's the end-all cure for lines and wrinkles. And really, what a facelift is designed to do is to treat laxity of the lower face, the cheek, the jawline, and the neck. So there are some wrinkles that will get better with a facelift, such as on the cheek or in the neck, but there are also lines like around the mouth that won't be affected at all. So in some cases, we need to do other things other than a facelift to treat the lines and wrinkles.
So if you've got droopy eyes, the facelift is not going to help.
That's exactly right.
All right, let's take a look at a before and after here and tell us what you've done for this lovely lady.
Okay, well, this patient had a simplicity lift, and you can see how now the jowling's been resolved, the laxity of the neck's been resolved, the folds around the mouth have been softened, but it didn't erase all the wrinkles. But this is a good display of what a small incision lift is designed to do.
All right.
On the other hand, for the next patient, laser resurfacing was done for this patient over her entire face, and you can see the different effect. Now we're treating all the brown spots, treating all the wrinkles, getting some tightening with the laser resurfacing, but not necessarily getting the type of tightening we get with a surgical facelift.
Was that just one procedure? That's pretty dramatic.
It was, just the resurfacing. So
that's amazing.
It can do a lot for a lot of people.
Looks like she had a lift.
Well, in the right situation, it does, because you do achieve some skin tightening with that procedure,
right?
Even though we're not surgically lifting and pulling.
All right. Now, some people think the facelift, of course, will help your eyelids as well, and not necessarily so. You do have a photo of the simplicity lift with the forehead lift, right?
Right. This is a patient who had a facelift and a forehead lift, and you can see now the upper face has been rejuvenated, the upper lids look better. Soften that up a little bit, and we've also achieved tightening of the lower face and jawline.
It's good to have the lower face match the upper face.
It's kind of a good idea.
You kind of want it to all go together.
Absolutely.
Laxity of the face and then, of course, the neck. Let's talk about options for that. Simplicity lift, plus we've got a picture of a full face laser, and that will help as well?
Well, if a patient has a lot of wrinkles and they've got sagging tissue that's lax, then the combination approach may be the best for that particular patient.
Okay.
So in that situation, this is a good example here. The patient who had full face laser resurfacing to take care of the sun damage and wrinkling that the facelift doesn't take care of, but we also did a lift to get the laxity of the jawline and the neck overcome. That's
amazing. We have another picture of someone who also had the simplicity lift plus the full face laser.
Again, she had a simplicity lift with perioral or around the mouth resurfacing initially, and then came back to follow up for resurfacing with over the rest of her face to treat the rest of the sun damage and wrinkles. And on the right, you see your post-op result, which gives us the best of both worlds.
Amazing. All right, Sharon, let's talk to you about your experience. You shopped around, didn't you, before you went to Dr. Jasin?
I did. I went to quite a few, 4 or 5 different places.
And what was it about him that made you say, okay, you're my guy?
Who's to figure?
He made me feel like I was the most important patient he'd ever had, and he answered all my questions, and his staff was wonderful. And it was an easy decision for me after I saw him.
What did you want to fix?
I wanted to fix the wrinkles that I had on my face and the sun damage, and I wanted to get rid of my jaws.
Well, let's take a look. There you are before. And yeah, I mean, you looked fine, but you're right, you had a little bit of jowling going on. So Dr. Jasin, tell us what you did.
We, again, did a simplicity lift with full face laser resurfacing to take care of both components, the aging of the skin as well as the laxity and sagging of the tissues.
And there's a profile shot. There's pretty dramatic.
That says it all right there. You can see the difference in her neck and jawline and the improvement in her skin too. So it puts the whole package together.
So Sharon, do you think now you look as young as you feel?
Absolutely, without a doubt.
You look fantastic.
Thank
Sharon
you.
Martin and Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute. Thank you both. And to get your questions answered or to schedule a consultation with Dr. Jasin, call 813-975-3223 or log on to jasonfacial.com.